It's time to take 5. Now you know.
All we do here are veins. We specialize in vein care, whether it's from one end of the spectrum, the large varicose veins, or the other end of the spectrum, the small spider veins. We take care of them all, and that's our expertise here, and that's what we focus on. Well, of course, most commonly, patients with varicose veins will have bulging veins, so the first obvious sign is the dilated vein. Oftentimes, though, patients don't realize the symptoms they're experiencing in the legs are due to the vein disease. Most patients will experience some sort of discomfort, but it can be very vague. Some patients will feel heaviness, achiness, muscle fatigue, but some will feel burning, stinging, itching, more severe symptoms. So the very first step is I have patients come to the office, I evaluate them and determine whether their symptoms could be vein related. And if they are, I explain to them what the treatments are and go from there. So that's why the initial evaluation is so important to determine whether vein disease is the cause of the symptoms or it could be something else. The one truism about vein disease, left untreated, it always gets worse, whether it's the large varicose veins or those small spider veins. Unfortunately, there is no cure. There's certainly treatment, but the disease will progress. I know patients would love to wake up one morning and see their veins have disappeared spontaneously. Unfortunately, with vein disease, that just does not happen. Varicose veins are more of a medical problem. If the disease progresses, patients can develop skin changes and ulcers. So those are treated totally differently than the other end of the spectrum, which are spider veins. Those are small, red, thread-like veins. They're treated cosmetically. The very first step in this whole process of treating your vein disease is the initial ultrasound. I need to do a mapping of the veins and find out what's causing the problem, what veins are working, which ones aren't. And I perform that ultrasound myself because not only do I have to determine what the problem is, I also have to come up with a game plan on how to treat that problem. Treatment for varicose veins, we utilize a minimally invasive procedure to eliminate what's causing the varicose veins. That particular treatment is usually a one-time treatment, unlike the spider veins, which can take multiple treatments. Initially for varicose veins, it was a surgery called vein stripping, which was a surgery. They take patients into the hospital and put them to sleep. But we've totally done away with surgery. Now the treatment for varicose veins simply involves a minimally invasive procedure that's done here in the office. It takes usually about an hour, and the great thing is patients go back to normal activities the very next day. There are several ways to treat varicose veins. Typically here at the office we use a laser or we use a process called VenaSeal. With a laser procedure, I insert a small laser fiber, which looks like a fishing line, into the offending vein. I then have to give numbing medicine along the course of that vein. Then I slowly pull that laser fiber back out, and that laser energy will seal up that vein from the inside. Whereas VenaSeal, it's more of a glue system. I thread a small catheter, a small tube into the offending vein, and leave little drops of glue behind, and that glue literally seals up the abnormal vein. The difference with the patient experiences is with the laser, I do have to give more numbing medicine. There are a few more needle sticks involved. Also with a laser procedure, patients typically wear compression stockings for 2 weeks. With the VenaSeal, typically there's only one injection with the local numbing medicine, and the great thing is no compression stockings are needed with that. Following treatment, the patient's symptoms usually go away within a week or two. The veins themselves, though, may take a couple of months to shrink down. They've been distended for a very long time, so it does take them time to shrink back down to normal. But the symptoms go away much faster than the veins actually do. Interventional radiology is a subspecialty of diagnostic radiology. The great thing about interventional radiology is we use small wires, catheters, or other small devices to fix problems from the inside using some sort of image guidance. So that's a very fascinating specialty that's taken patients out of operating rooms. Well, as an interventional radiologist, my whole focus has been on dealing with vascular disease. Here at Medicus, we focus on vein disease. We have the expertise, we have the state-of-the-art equipment. We go out of our way to make things as comfortable for you as possible, and our staff has extensive training in that. So we want to make you feel that you've gotten the best of care, but also that we care very much about you.